Hey everyone, welcome back. Today we are going to talk about a hormonal imbalance that can affect fertility. So it can cause irregular periods, absent periods, it can affect your uterine lining, it can cause luteal phase defects, so issues with progesterone. Certainly it can affect your ability to conceive. And it is issues with prolactin, usually elevated prolactin. And so if you're having any of these issues and your prolactin hasn't been checked, you may want to get on that. So let's dive into what this is. Hyperprolactinemia, which means high prolactin, is a condition that means there's too much prolactin in your blood. Prolactin is a very important hormone for the female reproductive system, and it's produced by the brain's pituitary gland. In women, prolactin is normally responsible for breast development and milk production during and after pregnancy. It also plays a role in regulating periods, as mentioned. Some of the symptoms are the ones I mentioned, like irregular absent periods, fertility issues, breast milk production while not pregnant or nursing. Weird, right? It can just be like also a little bit coming out of your nipples, change in the menstrual flow. So you could have like really light periods, or you could have bleeding at weird times, or you could even have heavy periods in some cases. Loss of libido, so no sex drive. Vaginal dryness for sure, because it's lowering hormone levels that would make you have more vaginal secretions. Hot flashes, so mimicking some like kind of like menopausal type symptoms. Low bone density, big issue, because when the hormones are off, they can start to affect bone density. Pain in the breasts, swollen breasts. Oddly, it happens to men too. Here are some symptoms for men: erectile dysfunction, so impotence, gynecomastia or male breast enlargement, headaches or problems with vision resulting from pituitary tumors affecting the optic nerve, decreased muscle mass, lack of body hair. So usually when a man is taking on kind of like feminized characteristics, that could be one of the culprits. Obviously, you know, a lot of estrogen and low testosterone could also be the culprit. Causes. So about 50 to 60% of women with hyperprolactinemia, it's due to a non-cancerous tumor in the pituitary gland that produces high levels of prolactin. It's known as a prolactinoma. Overactive cells in the pituitary gland, you know, there are disorders also. So overactive cells in the pituitary gland can also do it. Disorders that lead to an increase in white blood cells, that's histiocytosis. Tuberculosis, not very common these days, but it could. That's the, you know, the disease that used to kill people by affecting their lungs way back when sanitization wasn't very strong. And underactive thyroid, this is very common. Extremely common, especially when we get into fertility treatments. Underactive thyroid is huge. And hypothyroidism or underactive thyroid can be worsened by an excess amount of estrogens in your system or inflammation caused sometimes by some of the fertility treatments. Various medications can also cause hyperprolactinemia: antipsychotics, antidepressants, and antihypertensive, so blood pressure medication. Damage to the chest area from shingles or surgical scars, for example. Cirrhosis or scarring of the liver, again, less common. Chronic kidney failure, again, less common, and somebody trying to conceive is probably not going to have chronic kidney failure. You wouldn't be recommended to have a baby. Cushing syndrome, which results in high cortisol levels in the body, and cortisol is your stress hormone, just as a reminder. Cushing syndrome is something that, you know, would affect multiple systems, but definitely prolactin would be part of that. And I'll get into this a little bit later, but cortisol or high stress hormones can be a culprit in hyperprolactin. Empty sella syndrome, a condition that means the part of your brain is enlarged. Lymphocytic hypophysitis, an inflammatory condition of the pituitary gland. Sarcoidosis, a disorder that causes inflamed tissue to develop in the body's organs. So again, a lot of these are much less common. So you have the pituitary tumor, the benign one. You have various medications. You have other hormonal imbalances that can affect it. You have stress, which I think is an underrated one and probably a super common one. You have hypothyroidism. So these are the ones that I'd probably look at the most: the hypothyroidism, stress, the pituitary tumor. I would say those ones are the culprits more so than anything else. Typically, untreated hyperprolactinemia would affect fertility due to lost regular periods. So like the irregular or lost ovulation. Prolactin may cause infertility, by canceling your ovulation, obviously. But in less severe cases, high prolactin levels may only disrupt ovulation once in a while, making it just a little bit more annoying to track ovulation and time intercourse. And another issue is that hyperprolactinemia can actually make you not produce enough progesterone, and progesterone is your incubation hormone. It's what keeps your uterine lining thick. It's what helps to gestate a pregnancy. It also helps you to not have terrible PMS and not be as bloated and not get insomnia. So progesterone plays a big role in just like your quality of life, but obviously in making a baby, it's huge. Otherwise, fertility treatments wouldn't involve a lot of progesterone in the first trimester. Another thing that is important to note about not having enough progesterone or having hyperprolactinemia is that you don't generally produce a very good uterine lining. And I've had patients like this. And if you don't have a good uterine lining, you cannot have an embryo implant and get the resources it needs to thrive and grow. And some people with this issue might have early periods, for example, or spotting during their luteal phase. So the good news is that it's generally really treatable, even if you have a tumor. And, if you have any of these other more rare conditions, then, you'd have to treat the condition itself. With lifestyle and sometimes with medications, and then the prolactin may fall into place. If you have a more simple version of high prolactin, which again is really common with like very high stress levels, then here's what you can do. Vitex, also known as chasteberry, is one of my favorite herbs, and it has been clinically studied to determine its ability to influence prolactin levels, and results show its ability to reduce elevated prolactin levels. So it has been successful. A German study in the Journal of Phytomedicine covered 34 females with hyperprolactinemia, and showed a marked decrease in elevated prolactin levels in 80% of the participants. So that's pretty darn good. These women took 30 to 40 milligrams of chasteberry per day for 1 month, only 1 month, which is amazing because honestly, I've seen some of the medications like bromocriptine, I think, that's used for the pituitary tumor, and it doesn't even work very well, which resulted in decreased prolactin levels and as well as a reduction in symptoms of various menstrual disorders. Because I think I actually did a podcast on this. Chasteberry is amazing for PMS and for fertility issues. It's great for to increase progesterone production and to reduce PMS symptoms and bad periods. Vitex or chasteberry is known to encourage hormone balance and menstrual cycle regulation. Vitex encourages a normal luteal phase by supporting the progesterone and promotes regular ovulation. And I don't think that chasteberry on its own is going to do everything, but it is a very helpful ally in this process. So when low thyroid is part of the picture, we have to account for that too. We can't just only use chasteberry and then expect the prolactin to reset if there's a thyroid condition related to it. So that's why we always look at the full picture of what's going on, because it's not usually only one thing. And if we have to address the various things to make sure all the pieces fall back into place and the body resets. So hypothyroidism results in increased levels of thyroid releasing hormone. That's the TSH that they test on, when you do your labs. And that can in turn increase secretion of prolactin. The increase in secretion of prolactin may cause the hyperprolactinemia and may cause, the discharge of milk from your breasts. And so what do you do for healthy thyroid function? You eat a diet rich in iodine. So seaweed, seafood, you eat a diet rich in selenium, so Brazil nuts. And you may want to supplement a few key nutrients, B vitamins, vitamin C, E, and A. And you can find these generally in your prenatal, a good prenatal. And then minerals are key. So selenium, as I mentioned, from Brazil nuts, zinc and copper are also very important. herbs are magical for your thyroid. Ashwagandha and maca, for example, are two that I really like for thyroid function. When you have thyroid issues, you have to check in with your gut. If your gut is off, your thyroid is going to likely go off too. If you have high estrogen levels, it may affect your thyroid. So you'll have to be able to detoxify and metabolize the estrogen, maybe with B6 vitamin, maybe with DIM or calcium diglucarate, maybe with herbs. So not for nothing, if prolactin levels are affected by stress, we've got to manage the stress. Sorry, I know, because going through a fertility journey is very, very stressful. But there are things we can do. So there's the mindfulness stuff, right? Meditation, yoga, walking, taking pauses in the day, unplugging from your phone, big one. And then there are things that you can take. So ashwagandha and maca are both great herbs for your thyroid, and they're also great herbs for stress regulation. And they are totally safe and friendly when you are trying to get pregnant. So that's one way that you can manage stress. But, stress sometimes is physiological, like we're having too much caffeine, we haven't slept enough, we're really stressed out about the fact that we're not getting pregnant. Just don't fuel it. Don't fuel it with sugar. Don't fuel it with booze. Don't fuel it with extra caffeine. Don't give stress the food to soar, right? You want to, eat a more balanced diet. You want to exercise. You want to get outside. That's going to help a lot with the stress, and then help with your prolactin. Balance blood sugar. So, this is lesser known, but blood sugar imbalances can also affect your prolactin. So, the basics to balancing your blood sugar are eating protein regularly throughout the day, managing your stress, not eating a lot of refined food or refined sugars, trying not to eat at night, getting enough sleep. And so, like these things sound like basic things, but basics are often what you need to get the balance back. Like you can go to the big guns, you can go and do the medications, this, that, and the other thing. But then when the medications fail you in terms of you're not getting pregnant after that, and you're stuck doing the basics again to see if that'll work, my recommendation is, okay, go and do the medications if you want, but do the basics at the same time so that at least you're doing everything at the same time. Likely you're going to get to your destination faster. Inflammation, huge for prolactin, because once you have inflammation in your body, like all of the systems can start going haywire. So you definitely want to reduce the inflammation, eat an anti-inflammatory diet, get rid of the gluten, sugar, and dairy. Don't drink a bunch of booze. Don't calorie load at night. Like the same kind of principles. Don't eat a lot of refined food. Eat tons of vegetables. If you eat meat, eat good quality meat from farms or organic, grass-fed, and then on top of that, make sure your liver function is healthy, because our hormones are always affected by our liver function, because our liver metabolizes hormones a lot of the time. So lots of green veggies, B6 vitamin, and again, enough sleep and managing stress, because stress is the key link where it starts to affect all of the systems and knock hormones askew. Same with blood sugar, actually, and inflammation. If blood sugar's off, if inflammation's off, if stress hormones are off, it starts to knock everything askew. So these are things that you can keep in mind. Now, if the prolactin is causing issues with your lining, you correct it through the things that I've mentioned. And then maybe we are adding herbs and things to help your uterine lining. I've done other podcast sessions on that. So address the underlying prolactin issue. Like, is it your thyroid? Is it your liver? Is it stress? Is it inflammation? Is it a pituitary tumor? The low progesterone issue we need to address. And then, there are other things that you can build off of to get it so the whole picture is addressed and that you will be healthy and ready to gestate a baby. All right, until next time.